Question 1. A nurse is reviewing medications for a patient taking verapamil. Which new prescription should be questioned? A. Simvastatin. B. Furosemide. C. Docusate sodium. D. Acetaminophen. Answer: A. Simvastatin. Question 2. What is the nurse's priority when administering phenytoin? A. Infuse rapidly to reach therapeutic levels. B. Use dextrose-containing solution for dilution. C. Monitor for hypotension and bradycardia. D. Mix with other 4 medications. Answer: C. Monitor for hypotension and bradycardia. Question 3. A patient receiving haloperidol shows neck stiffness and upward eye deviation. What is the nurse's action? A. Notify the provider and administer diphenhydramine. B. Hold the next dose and monitor. C. Educate the patient that this is expected. D. Increase fluid intake. Answer: A. Notify the provider and administer diphenhydramine. Question 4. A patient with tuberculosis is taking pyrazinamide. Which side effect should the nurse monitor for? A. Peripheral neuropathy. B. Hepatotoxicity. C. Hypokalemia. D. Ototoxicity. Answer: B. Hepatotoxicity. Question 5. A nurse is caring for a patient on oral contraceptives who is also taking carbamazepine. What is the best teaching point? A. Take both medications together at bedtime. B. Use a backup method of contraception. C. Skip the placebo pills each month. D. No interaction is expected between the two. Answer: B. Use a backup method of contraception. Question 6. Which instruction is most important for a patient taking warfarin? A. Limit intake of dairy products. B. Increase fluid intake. C. Avoid green leafy vegetables. D. Maintain consistent intake of green leafy vegetables. Answer: D. Maintain consistent intake of green leafy vegetables. Question 7. Which symptom requires immediate follow-up in a patient taking allopurinol? A. Mild rash. B. Fever and chills. C. Drowsiness. D. Metallic taste. Answer: B. Fever and chills. Question 8. A nurse is preparing to administer 4-potassium chloride. Which is the correct action? A. Administer via 4-push. B. Infuse through a central line at any rate. C. Dilute and infuse slowly via pump. D. Mix with magnesium sulfate. Answer: C. Dilute and infuse slowly via pump. Question 9. Which side effect is most critical to monitor in a patient receiving olanzapine? A. Constipation. B. Sedation. C. Elevated blood glucose. D. Dry mouth. Answer: C. Elevated blood glucose. Question 10. A patient taking methimazole for hyperthyroidism should report which symptom immediately? A. Weight loss. B. Sore throat. C. Mild tremor. D. Increased appetite. Answer: B. Sore throat. Question 11. What is the most important safety teaching for a patient on alprazolam? A. Avoid alcohol. B. Take with grapefruit juice. C. Double the dose if anxious. D. Take before operating machinery. Answer: A. Avoid alcohol. Question 12. A nurse is reviewing discharge instructions for a patient on disulfiram. Which substance must be avoided? A. Caffeine. B. Alcohol in any form. C. Nicotine patches. D. Chocolate. Answer: B. Alcohol in any form. Question 13. Which patient on baclofen requires the most immediate assessment? A. Complains of fatigue. B. Has muscle weakness. C. Reports dizziness. D. Suddenly stops taking the medication. Answer: D. Suddenly stops taking the medication. Question 14. A patient receiving statin therapy complains of new muscle pain. What is the priority action? A. Reassure the patient. B. Encourage hydration. C. Notify the provider. D. Suggest exercise. Answer. C. Notify the provider. Question 15. A nurse gives regular insulin at 8 a.m. At what time should the nurse be most alert for hypoglycemia? A. 8:30 a.m. B. 9:30 a.m. C. 12 p.m. D. 2 p.m. Answer. B. 9:30 a.m. Question 16. A nurse is reviewing the MAR for a patient with chronic pain on fentanyl patch. Which additional order is concerning? A. PRN morphine. B. Stool softener. C. Naloxone injection. D. Diazepam PO. Answer. D. Diazepam PO. Question 17. What is the nurse's priority assessment before giving lisinopril? A. Lung sounds. B. Potassium level. C. Bowel sounds. D. Glucose level. Answer. B. Potassium level. Question 18. A nurse is caring for a patient taking phenazopyridine. Which statement is accurate patient education? A. This will treat the urinary infection. B. Your urine may turn orange or red. C. It should be taken with calcium supplements. D. Report any eye pain immediately. Answer. B. Your urine may turn orange or red. Question 19. What teaching is most important for a patient starting levothyroxine? A. Take with iron supplements. B. Take with food. C. Take first thing in the morning on an empty stomach. D. Take at bedtime with water. Answer. C. Take first thing in the morning on an empty stomach. Question 20. A nurse is administering chemotherapy and spills the drug on their glove. What is the appropriate first action? A. Rub hands together and clean with alcohol. B. Call environmental services. C. Remove gloves and wash hands immediately. D. Continue the infusion and document the event. Answer. C. Remove gloves and wash hands immediately. Question 21. A patient on vancomycin develops flushing and hypotension during infusion. What is the nurse's first action? A. Stop the infusion and call the provider. B. Document and continue the infusion. C. Slow the infusion rate. D. Administer diphenhydramine. Answer. C. Slow the infusion rate. Question 22. Which instruction is most important for a patient taking levodopa/carbidopa? A. Increase protein intake with each dose. B. Change position slowly. C. Take at bedtime for best absorption. D. Take with iron for better effect. Answer. B. Change position slowly. Question 23. What is the nurse's priority before administering amikacin? A. Assess bowel sounds. B. Check hearing and renal function. C. Monitor for visual changes. D. Review hemoglobin levels. Answer. B. Check hearing and renal function. Question 24. Which statement made by a patient taking cyclosporin indicates need for further teaching? A. I will report any signs of infection immediately. B. I will avoid grapefruit juice. C. I can stop this medication after 3 months. D. I will avoid contact with sick individuals. Answer. C. I can stop this medication after 3 months. Question 25. A patient receiving clindamycin reports watery diarrhea. What is the nurse's best response? A. Encourage fiber intake. B. Administer loperamide. C. Suspect C. difficile infection. D. Reassure the patient. Answer. C. Suspect C. difficile infection. Question 26. A nurse prepares to administer promethazine 4. What is the safest method? A. Undiluted rapid 4-push. B. Deep intramuscular injection. C. Administer through a free-flowing 4-line. D. Subcutaneous injection. Answer: C. Administer through a free-flowing 4-line. Question 27. A patient is prescribed lamotrigine. Which adverse effect requires immediate action? A. Headache. B. Diplopia. C. Rash. D. Insomnia. Answer: C. Rash. Question 28. A nurse is giving alendronate to a patient. Which is the priority instruction? A. Lie down immediately after taking the drug. B. Take with orange juice. C. Remain upright for 30 minutes after taking. D. Take at bedtime. Answer: C. Remain upright for 30 minutes after taking. Question 29. A nurse is evaluating a patient receiving magnesium sulfate. Which finding is most concerning? A. Drowsiness. B. Decreased deep tendon reflexes. C. Warm sensation during infusion. D. BP 110/70 mmHg. Answer: B. Decreased deep tendon reflexes. Question 30. A nurse is caring for a patient taking glipizide. Which meal-related instruction is correct? A. Skip meals to avoid hypoglycemia. B. Take it with the first meal of the day. C. Take on an empty stomach at bedtime. D. Combine with grapefruit juice. Answer: B. Take it with the first meal of the day. Question 31. A patient receiving tamoxifen should be instructed to report which finding immediately? A. Hot flashes. B. Leg cramps. C. Vaginal discharge. D. Unusual vaginal bleeding. Answer: D. Unusual vaginal bleeding. Question 32. Which task is appropriate to delegate to a UAP for a patient receiving opioid analgesics? A. Monitor sedation level. B. Record respiratory rate every hour. C. Evaluate effectiveness of the medication. D. Administer naloxone if needed. Answer: B. Record respiratory rate every hour. Question 33. Which finding is most concerning in a patient taking hydralazine? A. HR of 102 BPM. B. BP of 138/84 mmHg. C. Butterfly rash on face. D. Mild dizziness. Answer: C. Butterfly rash on face. Question 34. A patient is starting disulfiram. Which item on their home medication list requires follow-up? A. Ibuprofen. B. Multivitamin. C. Cough syrup with alcohol. D. Aspirin. Answer: C. Cough syrup with alcohol. Question 35. A patient is receiving methadone for opioid dependence. What is the priority assessment? A. Pain level. B. Respiratory rate. C. Bowel sounds. D. Blood glucose. Answer: B. Respiratory rate. Question 36. What instruction is most appropriate for a patient taking tetracycline? A. Take with dairy to avoid GI upset. B. Avoid sun exposure. C. Take with iron supplements. D. Use immediately before bedtime. Answer: B. Avoid sun exposure. Question 37. A nurse is reviewing a prescription for nitroprusside 4. What lab value must be monitored? A. Creatinine. B. Liver enzymes. C. Blood glucose. D. Thiocyanate levels. Answer: D. Thiocyanate levels. Question 38. A patient with atrial fibrillation is prescribed dabigatran. Which teaching point is essential? A. Chew the capsule for faster absorption. B. Store in original container. C. Stop taking if bleeding gums occur. D. Take with antacids. Answer: B. Store in original container. Question 39. A nurse administers naloxone to a patient with opioid overdose. What is the follow-up priority? A. Encourage fluids. B. Monitor for resedation. C. Provide a high-calorie snack. D. Assess pupil response. Answer: B. Monitor for resedation. Question 40. A patient taking atorvastatin reports dark-colored urine and fatigue. What is the nurse's best action? A. Reassure the patient that side effects are normal. B. Advise rest and increase fluid intake. C. Notify the healthcare provider immediately. D. Delay the next dose by 12 hours. Answer: C. Notify the healthcare provider immediately. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!